how does it work? You are going to place a smart peg, which is and the magnetic pulses vibrate on the smart peg, which is screwed onto the implant. Usually, I use a smart peg directly used to the implant. There is a device which can be used and screwed onto the multi-unit abutment, but the values are not as precise. So I would encourage you to measure directly to the implant. So the vibration frequency of the smart peg is measured, and more stable is the implant, higher is the ISQ. So you understand now it vibrates, more it's stable, and better it is. Then you can not only measure the initial mechanical stability, but also when you wait after a few months, determines the degree of integration. If you have fibrous tissue around the implant, the value will be lower than 60. Then bad. You need to reevaluate your case, change the implant, or wait 2 more months. So it will give you a lot of measures, interesting things like this.